Down syndrome. History. It is named after British doctor, John Langdon Down, who fully described the syndrome in 1866. The genetic cause of Down syndrome was discovered in 1959. It is a chromosomal disorder. It is also known as trisomy 21. Trisomy 21 means there's an extra copy of chromosome 21 in every cell. Cause. The extra chromosome content can arise through several different ways. 92 to 95% of cases, cause is a complete extra copy of chromosome 21, resulting in trisomy 21. An error in meiosis, called a non-disjunction event, causes the gamete to have an extra copy of a chromosome, and the resulting fertilized egg has a total of 47 chromosomes. The other common mechanisms that can give rise to Down syndrome include Robertsonian translocation and isochromosome. Mosaicism. In 1 to 2.5% of cases, some of the cells in the body are normal and others have trisomy 21, known as mosaic Down syndrome. People with mosaic Down syndrome tend to have fewer symptoms than those with trisomy 21. The other common mechanisms that can give rise to Down syndrome include Robertsonian translocation, isochromosome. Translocation. 3 to 4% of the cases of Down syndrome are caused by a translocation. In other words, a chromosome, or part of a chromosome, gets attached to another chromosome, often to 14 chromosome. The resulting fetus has 2 normal copies of chromosome 21 in addition to a third copy attached to another chromosome. An isochromosome results when the 2 long arms of a chromosome separate together rather than the long and short arms separating together during egg or sperm development. Maternal age influence. The chance of having a child with Down syndrome increases as the mother gets older. It occurs in 1 in 1550 live births in a woman's younger than 20 years. 1 in 25 live births in a woman older than 45 years. And this suggests that meiotic non-disjunction of chromosome 21 occurs in the ovum. Indeed, in 95% of cases the extra chromosome is of maternal origin. At age 25 the probability of having a baby with Down syndrome is 1 in 1,250. At age 30, the probability is 1 in 1,000. At age 35, the probability is 1 in 400. At age 40, the probability is 1 in 100. At age 45, the probability is 1 in 30. At age 50, the probability is 1 in 10. Medical complications. It causes about a third of cases of intellectual disability. 45% have either a stutter or rapid and irregular speech, making it difficult to understand them. After reaching 30 years of age, some may lose their ability to speak. People with Down syndrome experience a wide range of emotions. Senses. Hearing and vision disorders occur in more than half of people with Down syndrome. Between 20 and 50% have strabismus, in which the 2 eyes do not move together. They also suffer from cataracts, which is cloudiness of the lens of the eye. Ear infections often begin in the first year of life and are partly due to poor eustachian tube function. Excessive earwax can also cause hearing loss due to obstruction of the outer ear canal. Heart. Approximately 40% of patients have congenital heart disease. Most commonly defects of the endocardial cushions including atrial septal defects, atrioventricular malformations and ventricular septal defects. Cancer. People with Down syndrome are believed to have an increased risk of developing cancers derived from germ cells, whether these cancers are blood or non-blood related. Blood related. Children with trisomy 21 have got 10-fold to 20-fold increased risk of developing acute leukemia. Megakaryoblast form of acute myeloid leukemia is 500 times more common. Acute lymphoblastic leukemia is 20 times more common. Non-blood cancers. People with Down syndrome have a lower risk of all major solid cancers, including those of lung, breast, and cervix. Low risk is thought due to an increase in the expression of tumor suppressor genes present on chromosome 21. One exception is testicular, germ cell cancer, which occurs at a higher rate in Down syndrome. Endocrine problems of the thyroid gland occur in 20 to 50% of individuals with Down syndrome. Thyroid problems can be due to a poorly or non-functioning thyroid at birth or can develop later due to an attack on the thyroid by the immune system resulting in Graves' disease or autoimmune hypothyroidism. Type 1 diabetes mellitus is also more common. Gastrointestinal constipation occurs in nearly half of people with Down syndrome. One potential cause is Hirschsprung's disease, occurring in 2 to 15%, which is due to a lack of nerve cells controlling the colon. Frequent congenital problems include duodenal pyloric stenosis, Meckel diverticulum. Tooth loss. People with Down syndrome tend to be more susceptible to gingivitis. People with Down syndrome also tend to have a more alkaline saliva, resulting in a greater resistance to tooth decay. Fertility. Males with Down syndrome usually do not father children, while females have lower rates of fertility relative to those who are unaffected. The poor fertility in males is thought to be due to problems with sperm development. However, it may also be related to not being sexually active. Treatment. There's no specific treatment for Down syndrome, but there is a wide range of physical and developmental therapies designed to help people with Down syndrome reach their full potential. The earlier you start them, the better. Each child will have different needs. Management efforts such as early childhood intervention, screening for common problems, medical treatment where indicated, a good family environment are important. Health screening. A number of health organizations have issued recommendations for screening those with Down syndrome for particular diseases. This is recommended to be done systematically. At birth, all children should get an electrocardiogram and ultrasound of the heart. Surgical repair of heart problems may be required as early as 3 months of age. Heart valve problems may occur in young adults, and further ultrasound evaluation may be needed in adolescence and in early adulthood. Cognitive development. Hearing aids, or other amplification devices can be useful for language learning in those with hearing loss. Down syndrome typically have good hand-eye coordination. Learning sign language may be possible. Pointing, body language, objects, or pictures, are often used to help with communication. Education programs before reaching school age may be useful. Individuals with Down syndrome may learn better visually. Drawing may help with language, speech, and reading skills.